Very last point that I want to focus on, and you could anticipate it in a session like this, you know, in a sense it's not Medicare or the private sector, it's both in order to be effective. And there's a couple things I would say here. First is that there's kind of this food fight going on where the private sector says Medicare doesn't pay enough, and it's a cost-shifting argument. And I would just say that the Commission has different feelings about that. We have evidence that suggests part of the problem, not always the problem, is that there hasn't been enough restraint on the private side. That payment rates have been escalating and costs follow payment rates, and I'd be happy to discuss that when we get to questions. And I think the better strategy is both the private sector and Medicare recognizing that there has to be fiscal pressure, restraint on expenditures and or payment rates and utilization, as well as a move towards redesigning the delivery system. And for example, one of the concepts that's been talked about, and I know Mark has talked about this a lot, and so we're getting ready for the handoff here, is the notion of an accountable care organization concept, which we can discuss on question. And that would strike me as a very ripe area for the private sector and Medicare to come together, because I think if any one of them tries it, it may not be enough lift for providers to change their behavior. But I think if there were collaboration in given markets, I think it could have, certainly have a greater possibility for success.